Hello, everyone. Today we'll be presenting to you about AAC, which is Augmentative and Alternative Communication. So first of all, we acknowledge the tradition of custodianship and law of the country on which the University of Sydney campuses stand. We pay our respects to those who have cared and continue to care for the country. So let us give you an overview of what we will be presenting today. It's about AAC, the different types, and the speech pathologist and teachers' roles, and also the pros and cons of AAC. And finally, we have a mini quiz to test out our knowledge. And first of all, we are student speech pathologists from the University of Sydney. So this is Priscilla, and my name is Aiken. So let us give you an overview of what exactly is AAC. So as you have known, it's augmentative and alternative communication. It refers to any method of communication that makes it easier for someone who has difficulty speaking or communicating. Augmentative means to add to someone's speech. Alternative means they could be used instead of speaking. So AAC comes in many different forms. It can be used in a variety of ways because everyone communicates in their own personalized ways. So it is helpful for children or students with autism spectrum disorder, like ASD, which is ASD, or childhood apraxia of speech, CAS, or language delay or disorder, or even some physical disabilities such as cerebral palsy. And at some point throughout the path towards effective communication, a lot of children with CAS use AAC as well. It serves as a temporary bridge to speech for the majority of kids, helping them communicate more effectively and feel less frustrated as they try to develop their speech. AAC might eventually replace verbal or written language if the child has severe CAS and needs AAC as the main mode of communication. So, so we might as well give you a real life example of how students or children use AAC to communicate.
So some kids use high-tech AAC devices, which we would count that as like an iPad or a different touch screen that has a communication app downloaded onto it. This is called Touch Chat, and this is one of our students' boards, and he can easily say that he wants to help or to eat or to play. And then we can also talk about people that we see throughout our day, our teachers, our different friends, our students. And we can have describing words, so talking about the weather, talking about our feelings. It's just like how our brain kind of holds all our vocab in it. This is what we would want our students to use to have access to their vocab and be able to communicate. So this is a button, and they produced a vocal speech. So you can record any message on this button, and then when you hit it, the verbal speech will come out, and you can get your message across that way.
Yeah, so you can see it's basically involves some alternative like buttons or devices to assist children or students who need to communicate effectively. So let me change to provide you more information. So how can AAC be helpful in school setting then? So students with special needs or communication difficulties will benefit from using these AACs. It will allow them to communicate effectively, as shown from the video, and receive the necessary support. The use of these AAC systems will require support from a speech pathologist and also potentially a teacher at home, a teacher at school, or even the parents at home. The teacher and parents will work collaboratively with the speech pathologist and receive the appropriate training to ensure there's an effective communication. And also AAC will comes in many different forms. There are many different types of AAC as well. So options are, they're also broadly categorized in different options, which are low-tech AACs, mid-tech AACs, or high-tech AACs. So low-tech or non-tech could include things like using a computer with a voice, also refers to as a speech generating device, or using an app on an iPad or tablet. AAC can be used in a variety of ways because everyone communicates in their personalized ways, as we've mentioned before. So a person's entire array of AAC devices is referred to as the AAC system. So the optimal system for the student or children to be used will be chosen in consultation with the parents during the discussion with the speech language pathologist who works with the student. This is frequently this fre frequently takes the form of testing out a few alternative systems to see which one fits the child the best. So let me show you a little bit of different example as well. But first of all, let me show you a, a more a more direct example of what's the difference between a low tech or high tech. As you can see, this is literally the same board, but one involves the use of an iPad or a tablet, which include technology to be used. So this is broadly categorized as the high tech AAC. And from the lower half of the picture, you can see it's a printed out hard copy of the board. This is this is what we refer to as a light tech, low tech, or even non-tech AAC because it literally only involves a piece of paper and a printed hard copy. So let me show you some more examples of AACs. So there are something we call speech generating tools. These tools are designed for AAC users. So they are paper-based systems. They're like books with symbols or the printed hard copy that we mentioned before, or words that can help you communicate by such as sign language, and also something signing systems that are widely known by other people. That's called Auslan or keyword sign as well. So there are also some mainstream devices as well. You can put communication apps on devices like tablets and phones to help you communicate as well. So options could include things like using a computer with a voice, as shown here, also refers to as a speech generating device that we mentioned before. It also include tablets like iPad that have specialized programs like this. This is Prolog Coach, which is a specialized app on an iPad or a tablet. So alternative signing systems could also track eye movements, switches, or assistance from another person to operate for them. This is similar to the board that you've seen from the previous video before. So every AAC user will employ some type of low-tech AAC such as gestures, movements, or even actions. An environment-based AAC also aids in task comprehension and participation and could include visual timetables, first then boards, which are something like this, first and then, first then boards to show the sequence of action to the children and also provided with other visual support as well. So there's no one type of AAC that works best for all children. So the most crucial factor is that the student or the children and those working around them will need to communicate effectively by trying different approaches. So additionally, it is also critical to keep in mind that AAC shouldn't be used without language modeling. But regardless of the system, the modeling and promotion of speech will continue under the guidance and also collaboration with speech language pathologists. And now let me pass on to Priscilla to talk about more of our role and also the teacher's role.
Yep. So let's talk about who uses AAC or what people can use AAC. So AAC is used widely by many people, and this includes people who have an intellectual disability, autism, cerebral palsy, muscular dystrophy, or other neurologically related disabilities with motor problems. Some people use AAC to make their speech more understandable to others. They might use AAC when conversing with strangers or if they're in an unfamiliar setting. And some people only utilize AAC temporarily, such as right after surgery. Because every person is unique, every AAC system is unique for them as well. AAC users customize their systems to fit their needs. AAC is used by some people in multiple forms, which is referred to as multimodal communication, which basically means using multiple modes to communicate. The use of an AAC system won't prevent the person from learning to speak, and it won't prohibit them from using whatever speech they can. Utilizing an AAC system can actually aid in the development of spoken language. So from infants to senior citizens, a range of people can use AAC to support their communication. Here is the role of a speech pathologist when using AAC. So a speech pathologist can assist you or a student in choosing the best AAC system. Additionally, they aid in you and your conversational partner's acquisition of communication skills using AAC. Finding the correct instrument for the student is crucial because not every tool is effective for everyone. Another role is to help both teachers and students to utilize AAC to achieve maximum benefits. The speech pathologist may train teachers to support students using AAC and also model language for students as they learn to communicate using these systems. They also help find the right and the best AAC for students and support teachers in using it to help the student as well. So this might include collaborating with parents and teachers to get more use out of the AAC system by employing alternative access techniques like eye gaze, the usage of switches, or assistance from a friend. The speech pathologist or teacher can help the student learn the new visual vocabulary, keep a record of the student's informal communication methods so he or she can interact with strangers more comfortably, train the student's family members to use AAC in order to help them communicate more effectively, and improve the student's ability to communicate in order to help them participate in all aspects of life. Here are some ways to model language using low-tech AAC. So number one is to model the key words. Modeling the most important words which convey the meaning of the message will help the student obtain the main message of what's being said. Modeling correct grammar, such as I went to the beach instead of I go to the beach, will help the student develop good grammar. Pointing to symbols as you speak will associate the symbol with the word that is spoken and also reinforce the order of the words in the sentence. It also gains the individual's attention, so the student must provide undivided attention if they are to learn. Ways to model high-tech AAC is pretty much similar to modeling language using low-tech AAC. However, instead of pointing to symbols, it will be more about pressing buttons on the device. So now we'll talk about the benefits of AAC and why it is good. So using AAC could raise questions or concerns for you. Since professionals have been researching AAC for years, we know a lot about how it improves communication. Here are some advantages or benefits of using AAC and how research has helped us understand it better. So here we have some points. So benefits for low-tech AAC include that naturalistic gestures or signs could be embedded in everyday routines. It's also usually easier to learn, and some people may have already learned some simple gestures. For mid-tech AAC, it's easy to add new vocabulary, and symbols can be combined to make sentences and more practice for language. For high-tech AAC, advantages include it has limitless vocabulary to choose from and can be programmed to be individually tailored to the user. We've got some more specific advantages as a summary. So it improves linguistic skills, such as improving receptive and expressive language through both a verbal model and a visual aid. It lessens tension between the student and the teacher because the communication is more clear and effective. It boosts the students' communication confidence because being understood when you speak and being able to actively speak with someone will greatly increase communication attempts in the future. It reduces the students' fear because having a support system placed in for communication can greatly reduce anxiety. And lastly, it lays the foundation for potential speaking. So if verbal communication is possible for the student, but they aren't confident in speaking, using AAC will act as groundwork, which will motivate them towards verbal attempts. Now, let's have a look at if there's any downsides of AAC and any disadvantages when using it. Here are some points for all low-tech, mid-tech, and high-tech disadvantages. So for low-tech, it may not be recognized by others unfamiliar to the student. The motor skills may be difficult for some students to grasp. For mid-tech, it can be difficult to understand and find symbols at first, requiring lots of teaching time. For high-tech, it requires time and expertise to learn and use effectively and is also quite expensive. Okay, so now we've got some myths. And let's see if these myths these myths aren't true. So we will show you what's true and what's not. The first myth is that if a student uses AAC, they won't talk as much or at all. And that is false because AAC will only be a method of communication which acts as groundwork to give the student a voice and a means of expression as they work on developing more spoken language. It should be used for students who have specific disorders. And according to clinical experience and academic evidence, using AAC helps and doesn't hinder speech development. AAC users can also pick up reading and writing skills. The second myth is that giving the student just an AAC device or board to use is enough support. That is false because the student will need the support of a speech pathologist to help them model language and learn the symbols on the board. They will also benefit from the back and forth interactions and thus learn communication skills too. They can also benefit from hearing the speech pathologist say the words and point to them simultaneously, modeling the language for them. And the third myth is that the child or student may be too young to use AAC. So some are curious as to whether people must reach a specific age before using AAC. According to research, AAC actually benefits people of all ages, including those under 3 years of age. Very young people can learn to communicate by beginning with gesture, which is low tech, and it can be transitioned to high tech when they're more matured. So yes, AAC can be used right away for very little ones. There are no prerequisites for using AAC, such as having certain levels of reasoning ability or even passing certain tests. So none of these are needed. So in conclusion, AAC has many benefits and some drawbacks, but overall it is helpful for the vast majority of people who struggle to communicate. Okay. So now we have a quiz which will reinforce what you've learned throughout this presentation. And it has a total of around 5 questions. Oh. Hello, everyone. So we have a quiz time to check your knowledge. You ready?
Oh, okay. Let me scan the QR code first. Oh, okay.
Okay.
Give me a
Let's get
sec.
into it.
What exactly do I have to do?
Okay. So for these ones, the answer's already there, but you get to think about it yourself as well, okay?
Okay.
Okay, so this is about what we've learnt and some quick fire questions to grasp what was understood and what needs a recap.
Okay.
Here's the code. It probably doesn't work because we're in a different time zone to you guys watching it.
All right, I'll try regardless.
And the quiz is about to begin with all the answers for you.
Okay.
With some good music. So, question 1. AAC can be used by everyone who has communication difficulties. Is that true or false, Aiken?
Yes, I guess.
Yes, good job. Good job.
Okay.
Next question. Oh, everyone should note these questions down. The students should be supported when using AAC. We've got our choices.
Yeah, remember the modeling thing you mentioned?
Yes. That's right. So speeches should model the language, and teachers can do it if they know how to as well. Did everyone get it? All right, next question. What are two examples of modeling language for students using AAC? Aiken, would you mind telling us?
Pointing to the word and saying it to the student. Or you can point to the word and also expand it into a sentence. Something like that.
Yeah, great. So you can point to the word and say it for the student, or point to the word sit and expand it to sit on the chair. Great job. The rest are incorrect. Okay, second last question maybe? Oh, okay. So what is the benefit of AAC? Oh, no music anymore. Okay, well.
Sign language, gestures, and all the stuff. Yeah. Can help me in everyday settings. I think that's what you said.
Yeah, that's right. Exactly. Yeah. Just like it shows you on the screen. All right. I think this is the last question. Oh, so we've got a little short answer question, and someone has already, answered the question.
Yeah,
previously.
I think someone was pleased that they listened attentively. I hope
Yes.
that's the same for you guys as well.
Yes. Shout
Thank you
out
for
to
listening to
Julia.
our presentation.
Shout out to Julia, our CE, who did this quiz.
For joining into our Menti.
Yes, the only participant. And she's still the winner. So how did you guys go in this quiz? Did you guys learn something? We hope you did.
Yeah. We hope you are doing as good as this Pingu as well.
Yes, exactly. All right, well, that's the end, and we are going to end this presentation unless everyone wants to listen to music. All right, we're going to go.
Thank you, everyone.
Thank you, everyone. We're going over time, so we need to stop this. Okay, so well done to the winner. Everyone is a winner. Okay, let's go. Let's end.